This is Victor Abafe with A Healthier Democracy. And today, I want to break down the Supreme Court decision in Kennedy versus Braidwood Management and what it means for your healthcare coverage. In 1984, the U.S. Department of Health and Human Services created the U.S. Preventive Services Task Force. This is a volunteer panel of experts who are tasked with making evidence-based recommendations on which preventative services work best. Fast forward to 2010, after the Affordable Care Act was passed into law, it made those recommendations more influential. Insurers and health plans now had to cover, without cost sharing to the patients, preventative services that the task force rated on an A or B level. Think cancer screenings, vaccinations, cholesterol checks, and HIV preventative medications. Over 150 million Americans with private insurance are impacted by this regulation. A group of plaintiffs, however, led by Braidwood Management, a Texas wellness company, challenged this. They argued that the task force members should be appointed by the president and approved by the Senate. Their claim was that these members are principal officers, not just appointees under the HHS Secretary. The Supreme Court disagreed. In June of this year, the court ruled that the task force members are inferior officers. The court's holding was driven by the fact that the HHS Secretary can appoint and remove these officers at will and not for cause, as well as review and block their recommendations before they become law. Now, the practical implications of this ruling for your healthcare coverage means that the ACA's no-cost preventative care measures stay in place. Insurers must keep covering these same recommended services without extra charges. This ruling also means that the HHS Secretary, and by extension the presidential administration, can influence the list of covered services depending on their health priorities. This case and its outcome continues to show how consequential and still hotly contested some aspects of the Affordable Care Act continue to be.